Okay, hello everybody. Happy Saturday. Welcome to the Healthy Joints Healthy Lifestyle Show. And we are going to talk about gout, your burning, painful questions about gout. So, my name is Dr. Arinola Dada. For those who don't know me, I help people become pain free, and people with arthritis pain become pain free, and people with autoimmune disease get their immune system back on track. And I have my fabulous Dr. Deepa Gali, who is a rheumatologist that works at Overlake Arthritis Osteoporosis Center, and she is bringing 10 years of expertise in gout and autoimmune diseases to our show. So you're going to have two rheumatologists, right, battling it out on the most burning questions that were submitted to us. We're going to do a quick overview, and I'm going to have Dr. Gali, so happy to have her on the show, say a few words, and then we're going to jump right into the question and answers. Hi, Dr. Gali.
Hi, good morning. Happy Saturday to everybody. Hi, Dr. Dada. Thank you for inviting me on this show. You are fabulous and you are the guru of gout. I've learned a lot from you too in the last few months about gout. And here we are today to answer some of the painful questions for the patients who have been having the simple questions, yet nobody has answered them. So today we are going to tackle all of those questions, do it a very simple way so they can understand, and then go from there.
Okay, perfect. So we're going to start with the most basic, right? What is gout, Dr. Gali? Can you kind of, help people out with that?
Sure. Gout is a kind of an inflammatory arthritis where rheumatologist specialists deal with it on a daily basis. And a lot of our patients are going through this gout episodes, which they most of the time didn't understand why, what's happening. Here I'm going to tell you some simple things. What is gout and what are the symptoms of gout? Gout is caused because of the uric acid that's excessive in the body, which gets deposited in the joints and cause an attack. So the symptoms of the attack are five symptoms. Number one is usually it's sudden in onset. All of a sudden you wake up one day and one of your joint is painful and swollen. It's excruciatingly painful to a point that you're not able to put pressure. Even the blankets and the sheets touching the joint becomes painful. The second symptom you will see is the joint that's been attacked is really swollen, big, and it's warm to touch. And then the third symptom is the redness. You'll also see the skin over the joint changes color. It's more red and erythematous. And the fourth symptom is once there is swelling, redness, and pain, you're not able to move much the joint because of the redness and swelling. And the fifth is the symptoms usually last more than 3 days, at least lasting a week to 2 weeks, depending on how soon you get the treatment for gout. These are the basic five symptoms that you see with gout. And it's because of the excess uric acid. We'll talk more about how it's formed, what are the triggers, and everything going forward.
Yeah, thank you. That's actually helpful, because sometimes people have pain and they're wondering is this gout, and I think those five things are very helpful for people to be able to differentiate. So there is this general consensus, and I know we're gonna talk in depth. But this question came up. I think a lot of people have a list of things to avoid with gout when they have gout. But one of the things that people talk about also is sugar, right? And we always talk about high fructose corn syrup. Can you tell us how does sugar play? Do we avoid sugar? Does it make sense? What do you think?
Yes, and this is one of my favorite questions because I disappoint my patients. Because they're always asking, people are talking about high sugar. If I drink something, I'm going to get a gout attack. Here is the simple answer. So, a lot of foods have high fructose, and some of the beverages have high fructose. So, the thing that mostly triggers the gout is the fructose containing food and beverages because fructose is high in purines, and uric acid is a byproduct of purines. So, when there's more purine in the body, that means there is more uric acid in the body. When there's more uric acid in the body, that means it forms crystals, and these crystals are found in the joints, which causes the actual inflammation and trigger a gout. So you want to see like the foods that are high in sugar to avoid them if you're being diagnosed with gout, because that's one of the triggering foods. Processed food, sugary drinks, sweets have high fructose, and they convert into uric acid. So you want to make sure that you try to avoid this high sugar content so you don't have a gout attack. Well, sometimes patients are like, okay, should I completely go zero sugar diet? Not necessary, but if you're the kind of person who's drinking sodas, sugar, alcohol every single day, then you know you're getting high sugar beverages, which you want to definitely decrease and avoid those kind. But fruit sugar, some of them in low quantity should be okay, but again, it's different for each individual. Overall, we recommend avoiding high sugar diets because this also leads to obesity, and that can be a risk factor for developing gout. We
Yeah.
recommend a balanced food.
Yeah, and that totally makes sense. And and I'm glad you kind of mentioned also that fruits may be a little different from high fructose corn syrup and all
Right.
the artificial sugars. So kind of not feeling that, oh, I have to be completely deprived. Yeah, so
Mhm.
fruits, yes, but maybe just more that high fructose corn syrup. So thank you for actually differentiating that for patients. Another question that kind of came up is let me actually read it.
Okay.
Basically said that, hey, I got these supplements with omega-3 fish oil powder.
Mhm.
Could this cause a flare? This somebody that he's trying to be good, right? He's saying, hey, I know that omega-3s have anti-inflammatory properties. Could this potentially cause a gout flare? What do you think?
It's a very interesting question because this is the new medication that everybody has been asking me about, not just in gout arthritis, but multiple inflammatory arthritis. So, omega 3 is a fatty acid. It's a polyunsaturated, that means it's one of the good fatty acid that has an anti-inflammatory properties, where we usually recommend patients with rheumatoid arthritis because it kind of neutralizes the small amount of inflammation that's occurring in the body and help alleviate overall the symptoms of an inflammatory arthritis. So omega-3 fish oil supplements are good because of the anti-inflammatory properties. Well, the gout patients are particularly asking, will we also benefit from taking these supplements? Yes, the answer is yes. You take the supplements, but we don't have much data about, okay, increased taking of omega-3 during the attack, will it help? That we are not very sure. Still, there's research going on about that. But yes, one capsule every day definitely helps because of the anti-inflammatory properties.
Thank you. That's actually so helpful. Just kind of understanding that. Yeah. So it looks like across the board, the omega-3s, fish oil supplements are helpful. But would you say, so if you, let me ask another part of that question. So if
Mhm.
you do have a gout attack, right, and you
Mhm.
have inflammation and pain,
Mhm.
would omega-3 fish oil, would that be a reasonable thing to take to reduce the pain and inflammation? Any thoughts?
Yes, that is recommended because it is known as an anti-inflammatory property. So it does neutralize the inflammation, but it does not replace the treatment of gout therapy. So definitely you can take the supplements along with the gout therapy.
Yeah. Yeah. Okay. So that's, I think, what I wanted to kind of make clear, right? Is
Right.
because you can imagine a person says, hey, there's omega-3, it's going to help with the inflammation. I'm having this 10 out of 10 gout pain. Should I take a whole bunch of omega-3s?
Right, that's true. So that's the part we are not sure based on the research. They said the higher concentration, we don't know. The reason being the question is fish oil. So they say if you take fish, you get gout attack. So what about fish oil capsule? Why doesn't that cause a gout attack? That was the main interesting question. So let me ask you, Dr. Dada, did you have any patients ask you this question because it's derived from fish? Would that means it increases the gout attacks?
Yeah, it's such a it's exactly kind of what you're saying. It's kind of tricky, right? Because at the same time you don't want to kind of load the patient up with proteins that is going to break down to purines, that is going to cause more uric acid. But I would say that the quantity, so I think everything is quantity, right? The
Right.
quantity of omega of protein you're going to get from taking omega-3s of that of uric acid that is going to be different from if you took like 3 jugs of beer, right? Right. So I would still say that in theory, in reality, you're taking a couple of capsules of omega-3 to reduce the inflammation is likely not going to be the trigger for your gout. It's probably the beer that you took before that, right? Not to be facetious and to be more empathetic. So I think that's the way I would address it. But then I would also say kind of what you're saying, which is, hey, you still kind of need to treat the gout pain,
Right.
right? Yeah, the omega-3 is helpful kind of as a sidekick, but the gout pain does need to be treated as its own entity. Otherwise, there's just more suffering for longer, right?
Right. I agree, Dr. Dada. Thank you for answering the question.
Thanks, Dr. Gali. Okay, next question. So this person said, hey, I got my first attack late December, and so we're airing this now in middle of March. So last December he got his first attack. He kept reading about trigger foods. He's adhered to not eating foods high in protein for the most part. How soon after eating a trigger food does it affect you? Is it right away? Is it a few days? Any thoughts on that?
Yeah, good question. So it really varies from individual to individual. It For the gout to have a trigger or have an attack after consuming seafood or intake of high fructose beverages can vary. So some patients or some individuals experience the gout attack within few hours, that is 24 to 48 hours after the consuming of the seafood or high fructose beverages, but some people have had it within 72 hours and some people have had it within a week. That's how they know which is the food that triggered the gout, because they're able to relate, oh, yesterday I ate shrimp for dinner and today I'm having a gout attack. So most of the time, with clinical experience, we have heard from our patients that the gout attack can occur between 24 to 72 hours, depending on the type of food you ate. And we have also noticed that the high fructose beverage has a little faster, so it occurs within 48 hours based on the clinical experience. But again, it varies from individual to individual. So sometimes if it occurs after a week, it's hard for them to track back what was the food
What
that
trigger? That's so true. Yeah.
so, and then also the foods also it matters. So if you eat purines that are including red meat, organ meat, seafood, the concentration is high, the uric acid raises, so it can occur within the 72 hours.
Yeah.
Compared to,
Actually, yeah. Yeah. And that actually brings me to another question, right? Which is really fully understand, because I think it's very confusing for a gout patient to read through the list of foods that cause gout. And you have everything from beer to sardines to green peas to spinach. And I've had people say, excuse me, what exactly do you want me to eat?
right,
Right? So
right.
what do you think? I think let's go back. Let's kind of, I think I'd love to hear kind of your thoughts on how you kind of address that, and we can do a little back and forth and see what our thought process is on that.
Sure, yeah. And I have had personal experience when a young gout patient enters the clinic and say, hey, I have gout. Can you tell me a little bit about diet? End of the conversation, they're like, okay, you want me to just survive on ice chips? That's how many diets we kind of want to avoid. But to be specific, when you compare the meat, usually which includes like the organ meat, certain kinds of sardines and shellfish, which are the highest risk. But then salmon should be good. And certain vegetables like green peas, spinach, asparagus, they say we have avoided the whole meat. We are just gone vegan and we are eating all these green leafy vegetables. And then we're still having gut attack. Well, compared to eating organ meat, eating the vegetables like green peas, spinach, and asparagus has lower purine concentration compared to the meat purines.
Yeah.
So
Yeah.
it's still much better than not doing the meat part. But I think you are an expert on this diet as to which are the foods that they can eat without depriving themselves of the meat. So you tell me what are the good foods.
So I think that I like people to play within create a fence, and then you can play within it, right? So our body is actually able to process exactly what you're saying, like and if you kind of take a pound of spinach and a pound of red meat, you know what's causing it, you know what has higher urine, right?
Right,
It doesn't take a rocket scientist to
right.
know that pound for pound, right? So our body is actually meant to be able to process plants,
Mm-hmm.
protein better than animals. So exactly what you said, Dr. Gali, which is, pound for pound, you're going to get more uric acid breakdown from an animal product than from a plant product. So I
Mm-hmm.
kind of recommend to my patients, feel free with plants. Plants are not our problem. It's not the
Mm-hmm.
spinach that you ate, right?
Right.
But in terms of like the animal proteins, right, we still need some of them for those who are not vegetarians, right? So I say, okay, in terms of the foods, animal foods that are going to most likely precipitate your gout, it
Mm-hmm.
is going to be the shellfish. It is
Yeah.
going to be the organ meats.
Mm-hmm.
If you can avoid red meat, yes. So those are
Mm-hmm.
kind of the three biggies. And then
Mm-hmm.
everything else I'm saying kind of in moderation, right?
Right.
In terms of drinks, like beer is number one culprit, right? When I worked at the VA, I know I've told you that story before. Worked in the VA, our vets will go fishing and clamming and crabbing, and they'll wash it down with beer. And Monday morning was gout clinic, right? And so those are kind of the the real high risk foods. And then,
Mm-hmm.
of course, we always talk about high fructose corn syrup. So I think,
Right.
try to build a fence and like, this is where you can play. Eat the vegetables, eat the fish, in moderation, avoid shellfish, avoid organ meats. Beer is a no-no. Beer is the
Mm-hmm.
worst. Spirits are less so. Alcohol, least so. But water is best.
Yes, I agree.
So yeah. So hopefully that. Any other thoughts on that? Because I know food is kind of a big thing that people are trying to figure out what can they do. Because we're living in a world where we're trying to minimize medication, and
Mm-hmm.
people are trying to figure out, what can they do with their own lifestyle, which is
Right.
something that we preach. Any other thoughts on kind of lifestyle hints that we can give people?
So, couple of questions like we have had. Okay, we recommend eating white meat, chicken, turkey, compared to other red meats because of the increased purine. There was a person who had asked this question from the group asking, I ate turkey and it triggered. But was there something else that they ate the week before, 2 or 3 days before, and just related the turkey within the 24 hours? We don't know that part. So we want to also reflect back to 3 or 4 days before to make sure that they have not consumed one of these high purine food that triggered after 3 days, right? So that's number one to think about. And number two, we want to make sure that during the attack, if it's especially in the great toe, midfoot, forefoot, or anywhere in the feet or ankle, if you tell them go exercise, don't sit, they'll be like, yeah, right. So during the attack, it's very painful. It takes about a week to resolve. But we recommend lifestyle modification as be more active, exercise more in between gout attack. That way, we are losing some calories, losing some weight, which also helps with the gouty arthritis. Some of them have frequent gout attacks to a point that they've developed arthritis in the knee joints, ankle joints. For them, it's all the more important to be exercising and having a healthy lifestyle.
Yeah, yeah. So I guess, yeah. So it kind of exactly just reiterating what you're saying. So it's not just what you do the day of the attack, it's what
Mhm.
you're doing in between, right? That helps to determine if you're going to have another attack, to be honest, right?
Mhm. Mhm.
And so doing things to kind of keep your weight under control, like Dr. Gali says, is one of the most important things. Hydrating, because if you have a lot of weight that you're carrying, you're producing a lot of uric acid,
Right.
right? Just from breakdown metabolism, right?
Yes.
Um, yeah, so I think we have let me ask another question though, which we are all kind of talking about the nutrition and how important that is, but
Mhm.
I think we do need to address the elephant in the room a little bit,
That's okay. Yes.
which is, if you have gout, right? What kind of who can manage gout? Who should look at diet, right? Should everybody with gout, irrespective of their severity of their gout, always be looking at their diet? Or should I just feel I'm on medicines, I'm good? What do you think of that? Any thoughts?
Interesting question. So, once you have this is pertaining to gout patients, once you've been diagnosed with gout, taking medication decreases the uric acid, and these medications help our body excrete more uric acid, so we have low concentration. That in turn helps reduce the more gout attacks in future. Number two, maintenance therapy helps the uric acid go down, help with the joints. Number three, oh, I got medications. I'm doing good. My last gout attack was a year ago, and now I can just do whatever I can. Probably not. Even on medications, when the for example, you take a allopurinol or some medication for gout, and it's helping reduce the uric acid. And then from the other side, we start eating a lot of purine food. Then the uric acid is building higher. Then the allopurinol struggles to get all of the uric acid out. So you can have gout attacks while on treatment if you don't follow the dietary recommendations. This is usually what we have seen. I'm taking my medication, I'm still having a gut attack. Then we go in depth of the lifestyle that we learn that they're back to drinking high fructose beverages and eating red meat. So there's a trigger. So we still have to be a little cautious in moderation of doing what we're doing.
So I have one more question on our list, which is very important. And I think the patient says, can you have a fever if you have gout? Can you have a high temperature if you have gout? Thoughts, Dr. Gali?
Yes. So depending on number of joints involved, we also call something if there's more than one joint involved because of the gout attack, it's called polyarticular gout. And most of the time, these are the patient develop fever because there is a systemic inflammatory response from the body, which is created by the uric acid crystals. So they do get fever. But to be very cautious, we also want to make sure that we are not missing a septic joint because when there is a gout attack, for example, say there's a knee joint attacked by the uric acid crystals, it's swollen, red, painful, and the patient develops fever. If you're able to see a rheumatologist or go to the ER, if somebody's able to drain the fluid, we definitely recommend sending it for fluid culture. And then what we do in the meantime is treat for the gout and treat with antibiotic because until proven otherwise, we don't know if there's a septic in addition to gouty arthritis. And so once the fluid culture comes back negative for bacterial growth, then you can withdraw the antibiotics but continue the therapy for gout. Most of the time, we don't have fever, but if it's polyarticular systemic inflammatory response, they can. But if they have additional septic joint and a gout attack, they can also have fever. So that's something you have to meet with the professional to go over the differential diagnosis.
And that's I think that makes so much sense because I think anytime you arrive at your doctor's office or anytime you have swelling in your joints, the number one question is it infected,
Right.
right? Because if it's infected, which is what Dr. Gali said, that is if it's septic, right, which is infected, then it's a totally different pathway. The fluid needs to be taken out, antibiotics need to be given. So I think people have had gout multiple times in the same toe, right? We kind of know, okay, it's my gout, and people are like, it's my gout, But if you start having different joints, it's swollen, you're having a fever, it's kind of red, it's not acting like your gout, then sooner rather than later, and your doctors will take fluid out, run some blood tests, because we want to make sure that infection does not escape from that joint into the rest of the body, right? The infections are a big deal and is the number one thing that your doctors are looking at. And if you're not sure, ER or urgent care, let them get it checked out. Let's not assume that it's gout, because that's one thing that we don't want to accidentally misdiagnose. So good. So Dr. Gali, I think that we are kind of run out of time, but this was so much fun. I see some hearts in the corner. I think people really enjoyed this. So we're going to have to do this again.
Oh, sounds good. Thank you so much for Dr. Dada for having me and all the knowledge you shared. Thank you so much.
Well, thank you so much for your cast time, Dr. Gali. So we're going to do this again. I think this was a lot of fun. I love the fact that people sent us questions in advance. So we're going to be doing this intermittently over time. Dr. Deepa Gali and Dr. Arinola Dada are in the greater Seattle area. We're gout experts. We have an army of people to help you become pain-free. So if you think this video is helpful, like it, share it, tell your friends about Dr. Gali and how amazing she is, and we'll see you next time. Thank you, everybody.
Thank you. Bye-bye.